Right. Thanks a lot, Rebecca. I think it's the first time I speak after a medical doctor in a conference. I'm quite humbled to be here with all these health experts. Reminds me of a story of about 15 years ago. In a previous life, I was moderating a session in Davos on trying to promote investment in tourism into Africa. And there was 4 heads of state, the President of Kenya, President of Uganda, and the President of Ghana. And we started with one empty chair. It was the President of South Africa who hadn't made it. And about 10 minutes into the conversation, some noise happened at the back of the room, and in walked Archbishop Desmond Tutu and said, "The President sent me to come and talk to you guys about tourism in Africa." Well, he did a great job. He talked about South Africa's beautiful beaches and scenery. But I think I'm sharing this with you because maybe I'm having a Desmond Tutu moment here myself. Maybe I could just tell you a little bit about who we are. Oh, that doesn't start where it should. Okay, well, who we are a private equity investor. So we are a for-profit investor. We are focused on emerging markets. We call them global growth markets. We think it's a bit patronizing to call them emerging markets. We have 25 countries, 25 offices across the world, about 300 employees. And we've been operating for about 12, 14 years. We have $9 billion of assets under management. And we have been investing in mostly in cities because of the urbanization rate that we see increasing. And offering business opportunities, but also these markets not only have urbanization as a key trend, but have young demographic trends and have a rising middle class and middle consumer. So our investment thesis is very much based on this. We're managing third-party money, and our investors are expecting to get a good return out of that money. But we've been doing so, I think, with the concept of shared value very much at the center of our investment process, of the way we look at these opportunities, with very strong environmental, social, and governance principles, what in the investment world we're calling ESG, which is not just a ticking the box kind of exercise, but really trying to use the lenses of environmental, social, and governance practice to see how we can either create new markets for us, new sources of revenue, or create value, long-term sustainable value in the enterprises that we're investing in. So maybe what I'm going to try and do over the next 5-10 minutes is just to try and share with you how our investment team, because we don't only invest in health, we invest in logistics, we invest in financial services, we invest in education, we invest in energy, we invest in fast-moving consumer goods, but we have deployed across, over the last 12 to 13 years, about $1 billion into the healthcare space. So maybe just share with you a little bit how our healthcare team looks at this opportunity from an investment business standpoint. In these markets, the healthcare expenditure has been increasing by 6.5 times over the last 12 years as compared to 2.5 times in the developed world. And this is also projected against a growth in GDP per capita increase. And as I said, this is very much motivated by the high rates of urbanization that are taking place. And what's happening is that because of this urbanization in cities like Lagos and Accra and Mexico, is that we're seeing an increase in the rate of non-communicable diseases. And it's, when you're looking and working in emerging markets, we've had a tremendous effort over the last 10 years of bringing out millions of people out of poverty. But when you think about it, now they are going through, because of this success, they are subjected to new lifestyle diseases. And we risk a sort of a double dip of bringing these people back into some form of increased poverty because there's no affordable, high-quality healthcare services that are possible or available. This has denotates the sort of the how we're lagging behind in these markets compared to doctors per 10,000 population, nurses per population, beds per population. And of course, when these statistics come up, the outcomes can only be bad. If you just look at, we were looking at the maternal mortality rate a few minutes ago. I mean, in Bangladesh, that's 170 per 100,000 compared to 8 in the UK. So these are opportunities there also for the private sector to get involved. And particularly when you see that there is a potential $47 trillion global loss because of non-communicable diseases. And that's equivalent to 75% of global GDP today. And what is the cost to emerging markets and developing countries? It is $20 trillion, just in terms of economic output loss because of non-communicable diseases. Governments, as we have also alluded to, have been trying to do their bit, but it's not been easy. If you look at still in Mexico, even though the government of Mexico is trying to enlist universal health coverage, you still have 40% of people without health insurance. In India, the situation is even more dire. And government expenditures in healthcare, as compared to the UK, EU, in these countries, is very, very minimal. So again, there is a gap there that needs to be funded in part, and I say in part because all of the actors in development are needed to tackle this situation. Philanthropy has a role, overseas development assistance has a role, government expenditure has a role, but the private sector has a role as well. So in Nigeria, to give an example, there is a need for 700,000 doctors to reach OECD levels by 2030. That would require 300 years in terms of the actual training and education infrastructure that exists in Nigeria. It's a $51 billion in cost, which is equivalent to 20% of the Nigerian GDP a couple of years ago. So governments are listening. That is our experience. They are wanting to partner with the private sector to try and address these issues. In India, over the last, in 8 years, 2002 to 2010, 75% of the new beds were put into India by private sector initiatives. Public-private partnerships and their impact on the bottom of the pyramid, there is I think the most important sort of thing that we see moving forward in these public-private partnerships is that it allows for an alignment of government objectives with private sector opportunities, but bringing in, I think, as Mark mentioned earlier on, also the NGOs, which are extremely important in terms of their local knowledge and in terms of the delivery on the ground capabilities that NGOs have. So bringing the different kinds of finance, blended finance approaches to these large issues of education or healthcare is fantastic, but it's not just about finance, it's really about blended expertise, and I think that is often overlooked. And that is how, according to us and our practice, we've seen the possibility of increasing efficiencies, of increasing sustainability, of increasing delivery, and also of increasing affordability, which is a key thing in terms of health care access in these markets. So, you know, there's a couple of examples. One example is the one on the left, which is Mercado, which was a company we owned in the Philippines. It had 100 beds, it had a 55 years track record, and it got a contract to manage from the government of the Philippines the largest state-owned hospital. And through a number of years of creating more governance and more process and more efficiency in that large state hospital, we were able to treat an increasing number of people from the bottom of the pyramid by addressing also different price points for different segments of the population. But we also were able to create a medical college in that hospital. We were able to increase training. We were able to create rural services as well in places that would otherwise would have had to have flown their patients out into Manila in order to get care. So Yeah, this is, how much time do I have, Rachel? 5 minutes. Okay, so let me end maybe by telling you a little bit about one of the latest initiatives that we're undertaking, which is very much in the healthcare space. We are trying to be innovative, and I've got to be careful because of the SEC regulations, but we are, and we have raised finance in order to bring together around the table a private equity firm like ourselves, the Bill Gates Foundation, a development agency called the IFC in Washington, and a large corporate strategic company called Philips. And in our knowledge, it's the first time that these four kind of entities come together in order to try and address healthcare access in 10 specific cities in sub-Saharan Africa and South Asia. And what we're trying to do through this investment process is to not only buy a couple hospitals and operate them, grow them, scale them, and then exit, but it is really to try and fill the gap in that we've seen on some of these stats in 10 specific cities, the whole from diagnostics to training of nurses to building and making sure that procurement costs on equipment are lowered by having an approach which has 10 cities at stake. And also through a hub and spoke model and training programs for community workers to try and address the rural communities that don't have access to the healthcare systems in the cities. So we're embarking on this journey. The good news is that it's capitalized, it's financed. Our health teams are right now in India, they're in parts of Africa, they're looking at meeting with governments, local city entities, and are in some cases in far advanced stages of due diligence on how we're going to achieve this. So I think the role of business really can play a huge, huge role in addressing these, call them the Sustainable Development Goals, or in this case today, healthcare challenges. It's possible to do so. We're looking at how we can measure ourselves, and we've been doing that in our private equity business for the last 8 years. We have a proprietary sustainability index that we have 42 indicators. We've been measuring per company that we invest in and per fund that we manage the actual social impact that we have on the ground, and the financial performance too, because that is key to sustainability. But number of women that are employed, days of training in employees, health and safety regulations, and so on and so forth. And we're tracking all of this since the last 6-7 years in our private equity business. For our healthcare, we've created an impact committee for our healthcare activities. Derek, that just spoke earlier, is on that, on this impact committee. And with them, this is still work in progress. We are trying to identify how we can, what kind of metrics we can use in order to measure affordability, accessibility, and quality of healthcare in these markets that we're trying to put together. So I'll stop there. Thank you very much.